So the next speaker is actually right beside me, to my left. This is Shahana Alibhai. This is Dr. Alibhai's wife. Congratulations. How many months along are you?
Almost 9.
Wow, almost 9, so she's ready.
So if I have to stop for any reason.
Exactly, we know what to do. The exit's right there.
Yeah, exactly.
So, yeah, excited to introduce you. It's awesome. We tried to look at your credentials, and oh my gosh, there's so much. If you Google Shahana Alibhai, you'll be amazed. But I guess what I could say about you is I can't even plank on like a stomach full of like McDonald's, and you were able to plank with carrying a baby. If you go on Facebook and look up Stewart Chiropractic and find that video, it's pretty amazing. So, here's Shahana Alibhai.
Thank you so much. Thank you so much. Good afternoon, everyone. It's a real pleasure for me to be here today. To be honest, when we were planning this event, I've had some issues with preterm labor. Don't tell my doctor that I'm here, because I'm supposed to be on bed rest. But we thought the baby might be coming early. So I'm really, really happy to be here. It's the first ever Connect for Health event, and as you probably know, Khaled and I every year choose a word to kind of symbolize what this year means to us, and his word was connect this year. So it's a really special event for both of us, and just wanted to thank you all for being here and taking the time. And for me, it's especially important because I get to present on a topic that's really near and dear to my heart, which is techniques for managing stress and anxiety. So as most of you know, I'm obviously Dr. Alibhai's wife, and together we have a 2-year-old son, Ishan. I think he showed a picture of him on his presentation. And of course, we're about to do it all over again in maybe a few days, we'll see, welcoming another baby boy. So I think for this presentation, we were talking, Khaled and I said, I want to have a conversation with you more than just presenting at you. So in order to do that, I need to be truthful. I need to tell you my story. So I remember when Ishan was a year, people would come up to me and tell me how amazing motherhood was and what an amazing experience it was. And yes, motherhood is incredible. I second that. And I think every stage and age is fun with its own experience. But I certainly wouldn't use the word amazing to describe those first few months, especially in the postpartum period. In fact, if I had to tell you what I learned in the postpartum period, the words, the power of vulnerability, would come to mind. And if that sounds familiar, it's because it is. It's the title of a very famous TED Talk by Dr. Brené Brown, viewed over 29 million times. If you haven't seen it, please check it out. It's amazing. And in this talk, she speaks about the power of connectivity, that as human beings, all we want is to be connected to one another. But the flip side of that is being disconnected. And at the core of being disconnected are two things: shame and fear. And what's interesting is if you think about your deepest anxieties, your deepest fears, your deepest stresses, at the core, you'll find shame and fear. I'm not good enough. I'm not pretty enough. I'm not smart enough. The list goes, I'm not tall enough. The list goes on and on. My sister's 5'8", so I've always felt that way. So I think for me, going through that first few months postpartum, I would joke with people and say, oh, you know what, medical school was so much easier compared to maternity leave. You know, that was a breeze. But what I really wanted to tell people was that I'm struggling. This is hard. The sleepless nights are hard. Breastfeeding is hard. It doesn't look like what it looks like in the movies. It really doesn't for me. And I think what I struggled with the most was the shame of not being able to hold it all together. And the fear that why am I not enjoying this as much as I thought I would enjoy it? So fast forward 3 to 4 months postpartum, and I felt like I was running a race, running a marathon, basically. And like many marathon runners, I finally hit the wall. I remember that night really clearly. I woke up, heart palpitations, shortness of breath, sweaty, this feeling of doom. And if I had my physician hat on, I could tell you in an instant I was having a panic attack, easy. But as a patient, I had no idea what was going on. It was an out-of-body experience. And it took me months to actually reach out and talk to somebody about it. I was in complete denial. So what's interesting is that the road ahead was long and windy, and a little bit longer and windy. But at the end of the day, I found myself craving to talk to other people about my experience. I would talk to friends and colleagues and families and even strangers. and moms at play groups and say, well, how was your experience? What did you find? And it didn't take me long for another mom to tell me the few words that I really wanted to hear. Me too. It's also hard. It's not just you. And suddenly, I found my connectivity. So today, it's important that I make a little disclaimer that I'm not an expert. I don't really know who is an expert in stress and anxiety, but I'm not a psychiatrist. I'm a family physician, but rightfully so. Family physicians deal with this every single day. We are on the front lines of dealing with this. And most of my work is done at the youth clinic, so I see marginalized youth between the ages of 12 and 24. And the two things we deal with is mental health and then contraception. But mental health would be number one. But I think at the end of the day, I have a lot of experience in this topic, but more importantly, I have a lot of empathy now, because I'll be really honest, we're going through medical school, yeah, mental health checklist, you memorize all this stuff, but you don't get it. Until you've walked a day in somebody's shoes, you don't understand. And now, when I ask patients questions, they'll look at me going, you really get it, don't you? And you really understand. And I think that's why I take the extra time with my patients, especially the younger ones too, because for a teenager to come sit in front of me and tell me this, if it took me months to reach out for help, it takes them a lot of courage to do that. So I really commend them. But I think it's important when we talk of today that we understand what is stress and what is anxiety. And stress doesn't need a definition, I know that. But I think what we don't understand is that a little bit of stress is actually a good thing. And you can see the stress continuum. That's the green portion. There's a TED Talk on this too, how good stress can be sometimes. But in any case, the green part is what we call eustress. So this idea of what gives the competitive athlete his edge over another person. It's once you get into the yellow and red zone, that's what we call distress. This idea of being in the fight or flight or freeze response constantly. And this is when you hear those things about adrenal fatigue or excess cortisol secretion or all those types of things when your body just can't do it anymore. You're burning yourself from the inside out. And that kind of comes to that stat saying 75 to 90% of visits to a family physician is often due to chronic stress. So I really have to say that I think family doctors need to do a better job of understanding what's happening in our patients' lives. Because in a 10-minute appointment, it's very easy to kind of go through your little checklist, but it's much harder to ask, well, actually, how are you feeling? Or how's your relationship? Or what's really happening? Because if you can understand that, most of the times you can understand their ailment or why they're coming in. If we flip things and try to understand anxiety, anxiety is just an umbrella term. It can mean so many different things to different people. It can be panic disorder, PTSD, OCD. The most common type is generalized anxiety disorder, this idea of being the classic worrywart. This is the GAD-7, and I just put this up briefly because this is the tool we use in the office. If somebody comes in saying, look, I'm feeling really anxious, I give this to them to go, well, tell me a bit more about your anxiety. Are you feeling restless? Do you have that feeling of doom? Those types of things. But what I want to share with you all here today is that once I bring this subject up, it could be you, it could be a loved one, it could be a friend. If you recognize these symptoms in yourself or someone you love, and it's starting to affect your day-to-day life, how you eat, how you sleep, how you interact with others, don't be like me and wait months to talk to somebody. Talk to your family doctor or somebody that you trust. People have this stigma that it means you need to be put on a medication right away or see a therapist right away. It doesn't mean any of that. It just means that you're starting a conversation. So this is our journey today, and you can imagine in 15 minutes, it's really hard to cover techniques for stress and anxiety. There's so many different ones. But the analogy I want to use is that of a mountain. I chose Mount Kilimanjaro because I'll put a plug in for my husband, that he climbed this when he was 16, which is amazing. What we want to think about is the idea that we can break these techniques into two categories. The idea of when you're at the top of the mountain peak, being when your stress or anxiety is 10 out of 10. Those are the times we need to give you calming techniques to bring you back to level ground. On other days, you're kind of just rolling hills, just doing your little hike, trying not to get to the 10 out of 10. And I'll call those preventative techniques. So let's start with those. So the first technique I want to talk about is mindfulness. So take a second and put whatever you think about mindfulness or meditation on the side, because a lot of us have these preconceived notions of what meditation actually is. But if you feel comfortable, close your eyes if you want, and think of two different scenarios. The first being, you're inside your house, you're kind of on a windowsill, drinking something warm, you're comfortable, and suddenly you're looking outside and it starts to rain. Actually, it starts to downpour. There's thunder, there's lightning. But instead of being in it, you're kind of just watching this curiously, going, oh, that's kind of nice, but you're warm and you're comfortable. The second scenario is that you're lost in a car park trying to find your car, and suddenly it starts to drizzle, and now it starts to downpour and rain, and same thing, thunder and lightning. So not only are you lost and frustrated, but now you're wet and you're kind of caught in the middle of a lightning storm. So which of these scenarios would you rather be in? So it doesn't take long to figure out, obviously, the first. And no, I did not come up with this analogy. It was created by Andy Puttycombe, who's a Buddhist monk turned creator and CEO of Headspace, which is a very common mindfulness meditation app. If you haven't heard about Headspace, please do check it out. It's fantastic. Both Khaled and I use it on a regular basis. But the reason I bring this up is that the analogy is the analogy for mindfulness. This idea that in mindfulness, you take a very open, non-judgmental, curious response to your thoughts. So as if you're observing your thoughts like cars along a highway, instead of being actually immersed in all of that negative emotion. So the technique is called noting. So you note a thought, and then you come back to your breath. They've found that people who successfully can use this noting technique have a 50% reduction in their anxiety level. So mindfulness, the techniques are simple, but they're not easy. And we practice, they're not easy, I know that. But I'll tell you this for sure, mindfulness is not going anywhere. We're going to be hearing more and more and more about it. I recently took a mindfulness-based stress reduction course at the university, and they've said that over the past few years, the explosion in literature on mindfulness is just really mind-blowing. We're seeing results in anxiety, depression, schizophrenia, postpartum. It's incredible. So, and even at a recent Google conference, they showed that there's been a 50% increase in people typing in mindfulness or meditation in the search engine. So, you know what, put your preconceived notions aside, check out Headspace, there's lots of mindfulness apps out there, but I really encourage you to try to make it part of your everyday life. And that's what the logo looks like. The second thing is that I think there's handouts at the back on the pink table, which I guess is my table, but on this cognitive distortion. So the second technique is CBT, or cognitive behavioral therapy, which I'm sure a lot of you have heard about. Basically, it's a form of psychotherapy that we commonly use to treat mild to moderate anxiety and depression. Why do we treat it with this? Because it's actually been shown to be more successful than SSRIs, which are the most common type of medication that we use. So in CBT, the idea is that there's a connection between your thoughts, your feelings, and your behaviors. So it's very hard to control your thoughts, but you can control your feelings and your behaviors towards your thoughts. And one of the fundamental principles is to identify your cognitive distortions. So if you can, some of you might have picked this up, but when I first saw this handout, I was blown away. Like, we should be teaching this in high school. Everyone needs to know the pitfalls that we fall into in terms of our unhealthy thinking styles, and we all do this. And it's funny, you probably can recognize what your spouse does more than what you can do, but really take a look at this list. These are things like the shoulds and the coulds and the musts. You know, I should be a better mom. I should be doing this better. Or this idea of black or white thinking. It's either all of this or all of this. There's no in between. So please, at the end, when you guys leave today, pick this up. You know, we don't have enough time to go through each one, but I want to just pique your interest in CBT and that this is a really, really useful technique to do. The third technique is this idea of gratitude. So I love this quote. I opened 2 gifts this morning and they were my eyes. So So I told you guys that I recently went to a mindfulness-based stress reduction course, and part of our homework 1 week was to identify everything bad that happened in that week. So you write it down and you share it the next week, and the following week was to identify everything that was really good that was happening that week. And what we ended up discussing was that it was so much easier to identify the bad and to identify the things that were frustrating. But I really had to work hard to think about a good thing that was happening in my day. I know that sounds sad, but that's true. And I think Tony Robbins says it best. He says that your brain's job is for you to survive. It's not to make you happy. Isn't that true? He also goes on to say that the two most common negative emotions are anger and fear, or variants of those. And I'm stealing his words, but he says that if you have gratitude, you can't have fear. And if you have gratitude, you can't have anger. So it's a simplistic tool, I know, but don't underestimate the power of it. And whether you use it on a gratitude walk or practice a gratitude journal like he recommends, or just use it when you're feeling anxious and overwhelmed, go back to this technique because it can be extremely powerful. So now let's switch gears and let's think about when you're at the top of that mountain, when your anxiety is like a 10 out of 10. You know, thinking about gratitude when you're having a panic attack, I'm sorry, it doesn't maybe work that well. But these are 3 techniques that can really bring your anxiety down quite well. There's a handout on this first one called the box breathing technique. It's also called the SEAL technique because it's endorsed by the US Navy SEALs, and if they use it, it's probably going to be pretty good. So it's a very simple technique, and it's imagining that you're breathing in a box-type pattern. So you simply inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and hold for 4 seconds. Obviously, very simple, but this has been shown to activate your parasympathetic nervous system, bringing down your heart rate and bringing down your blood pressure. So an excellent, excellent tool to use next time you're stuck in traffic. And I say that because it took us almost 75 minutes to get here from Abbotsford, so I could practice a lot of these techniques while I was having contractions in the car. So I was like, please don't come right now. The second technique is a really cool one. It's called the butterfly hug. And it was a therapist that specializes in treating patients with PTSD who was talking to me about this technique. It was actually designed by a therapist to help survivors of Hurricane Pauline in Mexico many years ago. But what it is, and I'll show you how it looks, you actually cross your hands, if you want to do it with me, cross your hands one over the other, and you tap like a butterfly. Yeah, so one after the other, right? So the reason we do this, it's actually a technique we used at EMDR, which is a eye movement desensitization and reprocessing technique, but it's used for survivors of trauma, really. And the idea is that when you stimulate yourself by crossing your arms, you're stimulating both sides of your brain, and you're actually helping to bring your anxiety level down. This is a fantastic technique to use in kids or youth who have a lot of anxiety, because kids can really get this. But you'll be amazed. You think it's really simplistic, but it really works. The therapist who showed me this, she uses that at the dentist, actually, because she really had a lot of fear going. So she'd be sitting there in her dental chair doing this, and it can really bring your anxiety level down. So Google the butterfly hug. There's some great videos. And if you have kids in your life who suffer with anxiety, talk to them about it. Last but not least is this idea of tapping into your senses. And this is really grounded in mindfulness here. When we get caught up in anxiety and stress, we get caught up here in our brains. We forget what's happening in our bodies. So if you think about it, when you're sitting in a traffic jam and you're getting all anxious and stressed, do you actually think about what's happening with your 5 senses? Absolutely not. But next time, try it. Think about the grip of your hands on the steering wheel, or the breeze, or that feeling of the coldness on your face. Or actually listen to the music instead of just having the music right in the background. Or smell the coffee from your coffee cup beside you. By tapping into one or all of your 5 senses, it's amazing how much your anxiety can be brought down. So try that as a technique. So those are my 3 peak techniques when your anxiety really is a 10 out of 10. So I know there was a lot that we covered there today, but I really want to applaud you all because there's a reason why you're all here today. I know you probably love Dr. Alibhai and want to support Stewart Chiropractic, and I appreciate that. But just by being here shows me that you have a genuine interest in improving your health and wanting something greater. And the reason I ended with this beautiful picture of the blue sky is that Andy Pettycombe, the same person that created Headspace, says, and he's got a great video on this, he says that at the end of the day, there's always going to be clouds in the sky, and those clouds are your anxiety, your stresses, your negative thoughts. But never forget that one day those clouds will part. The fog will roll away, and all that you're going to be left with is that beautiful blue sky. It never went anywhere. You just have to look up. That's it. Thanks so much, you guys. There you go. No problem.
All right, let's give another hand for Shahana Alibhai. That's so awesome. Sorry?
Is there questions?
I think it might be.
Okay.
Does anyone have any questions for Dr. Alibhai?
If not, that's totally fine. Great. Thank you guys so much.
Awesome. One more time.